Hello everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer, the information provided in this program is to assist you in exploring all available options to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional or medical or other kinds of advice. So in the previous recording, 1 of 4, we looked at the appearance of breasts and nipples. And in this recording, 2 of 4, we will be looking at breast anatomy in more detail. So this diagram shows the anatomy or structure of the breast. So let's just notice some significant parts. Here on the outside, we see the nipple. And it is an extremely elastic structure in the middle of the areola, and it contains smooth muscles which contracts with stimulation. And this causes the nipple to become firm and protrude or evert or stick out, however you want to describe it. So the nipple contains many sensory nerve endings, and these nerves in the nipple are important for sending a nerve message to the brain, so that the brain can release oxytocin in the blood, which travels back to the breast, and that causes the milk to flow, or we call this the lay-down reflex, and we'll chat about this in the next recording. Now, breast surgery, baby's very weak suck, or the use of a nipple shield, particularly if it's a thick, non-flexible one, that can interfere with the stimulation of this nerve, and that interferes with oxytocin reflux, and that interferes with the volumes of milk the baby is able to take per feed. So you can see the importance of this stimulation or the lay-down reflex. The nipple also contains a few nipple pores or openings, and research shows that it is between 4 and 18 openings in the nipple through which the baby suckles milk. Now the nipple and the areola are flexible, and it shapes to fit the baby's palate and tongue and gums during feeding. And I've mentioned before that nipples can vary in size and shape and elasticity and how far they stick out, etc. And that these variations are only relevant if they interfere with the latch or suckling. So again, don't think because your nipple appears flat that it is indeed flat. A nipple at nipple's appearance at rest is not as important as how it functions when it is in the baby's mouth. And as mentioned in a previous recording, a compression test can help you identify if your nipples are truly inverted or flat. Now, the areola is the darker skin surrounding the nipple, and the baby needs to have a large amount of the areola, depending on the areolar size, in their mouth to feed effectively. On the areola, there are small bumps, and they are called Montgomery glands. And these glands secrete an oily fluid to keep the skin healthy and clean and lubricated. So they are also the source of smell of the mother's breast, and it helps the baby to find the breast and recognize the mother. So it's not necessary, and it should be discouraged, that women wash their healthy nipples and areolas with soap. They can simply clean it with water when needed. Now, on the inside of the breast, one will find milk-making tissue, that's alveoli and ducts, and they are all surrounded by supporting tissue and fat. Now, in the slide, there's a square, and in the square, there are a few alveoli enlarged. Now, this is just a different representation of alveoli. To explain it easier, so alveoli are grape-like structures, and they are clustered together like bunches of grapes in groups of 10 to 100. Now, these clusters of alveoli then drain into a common duct, and these clusters are called lobes, and I've just indicated with a purple box. So a lactating mother has between 15 and 25 of these lobes organized around the nipple, like the spokes of a wheel. Okay, so as mentioned, each of these lobes has between 10 to 100 alveoli. And alveoli are also lined with milk-secreting cells called lactocytes. And alveoli are surrounded by a basket of muscle cells that can contract. And alveoli are also surrounded by capillaries, which is just the smallest of blood vessels, bringing nutrients in the bloodstream to the milk. Now, a hormone called prolactin, which is just that yellow triangles on the slide, is one of the main hormones telling the milk-secreting cells to make milk. Now, milk is then secreted from the lactocytes or milk-making cells and held in the alveoli lumen or cavity. And when the hormone oxytocin makes the muscle cells or the myoepithelial cells surrounding the alveoli contract, the milk is then squeezed into the ducts and out through the nipple. Now, I think it's useful to understand the basic breast anatomy and physiology, just to understand how to bring about an oxytocin reflex before expressing, and perhaps understanding some basics around feeding management should there be an issue with baby's weight. Okay, thank you for watching this recording. In the next recording, 3 or 4, we will look at breast physiology in more detail. So please visit the Breastfeeding Clinic at breastfeedingsa.co.za if you would like to book a private consultation and receive these breastfeeding class notes. And you can also navigate the class recordings easier from the website. And please feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.